The physiological effects of heat tissue expansion. When heat is applied, tissues expand due to increased molecular movement. This can lead to improved flexibility and reduced stiffness in joints and muscles. Metabolic rate. Heat increases the metabolic rate, which can accelerate healing and tissue repair. Pain relief. Heat therapy is commonly used to relieve pain, especially in conditions like arthritis or muscle strains. Muscle relaxation. Heat helps relax tight muscles, reducing spasms and stiffness. Improved circulation. Heat increases blood flow, which can accelerate healing and reduce inflammation. It is worthy to mention that there are specific heat receptors and cold receptors in the skin. The role of thermal receptors in the skin, which detect changes in temperature and send signals to the brain. These receptors help the body respond to temperature changes by triggering physiological responses like sweating or shivering. The hypothalamus acts as the body's thermostat, regulating temperature by controlling blood flow, sweating, and shivering. Blood vessels expand, which is known as vasodilation, to release heat, and constrict, which is known as vasoconstriction, to conserve heat. Deep heat therapy. Ultrasound. Ultrasound therapy uses sound waves to generate heat deep within tissues, promoting healing and reducing pain. Diathermy. Diathermy uses electromagnetic waves to produce heat in deep tissues, often used for treating joint and muscle conditions. Paraffin baths is a form of deep heat therapy which is used for treating joint and muscle pain. Paraffin baths are effective for relieving pain and stiffness in conditions like arthritis. The affected area is dipped into warm paraffin wax, which then solidifies and retains heat, providing deep warmth to the tissues. Contrast baths is another type of deep heat therapy where alternating hot and cold water is used to stimulate blood flow and reduce inflammation. The affected area is alternately immersed in hot and cold water, typically for 3 to 4 minutes in hot water and 1 minute in cold water. Contrast baths are effective for reducing swelling and improving circulation in injured areas. Hydrotherapy, including hot tubs, whirlpools, and underwater exercises, is effective for relieving pain, improving mobility, and promoting relaxation. Use of whirlpool baths, which combine warm water with jets of air or water to provide a massaging effect. Whirlpool baths are effective for relieving muscle tension, improving circulation, and promoting relaxation. Therapy using cold leads to vasoconstriction, which reduces blood flow to the affected area, thereby decreasing swelling and inflammation. It also slows down nerve activity, which helps numb pain and reduce muscle spasms. Additionally, cold therapy reduces metabolic activity in tissues, which can prevent further damage in acute injuries. Benefits of cold therapy, including reducing swelling and slowing down metabolic activity in injured tissues. Cold therapy is commonly used for treating sprains, strains, and post-surgical pain. Different types of cold therapy. Ice packs. Ice packs are commonly used to reduce swelling and numb pain in acute injuries like sprains or strains. They are typically applied for 15-20 minutes at a time to avoid tissue damage. Cold compresses. Cold compresses are similar to ice packs but are often softer and more flexible, making them suitable for areas with uneven surfaces. They are also used to reduce inflammation and pain. Cold baths. Immersing a body part in cold water can help reduce swelling and pain, especially after intense physical activity. Cold baths are often used by athletes to speed up recovery. Cryotherapy. This involves exposing the body to extremely cold temperatures for a short period. Whole body cryotherapy is used to reduce muscle soreness and inflammation, while localized cryotherapy targets specific areas. In some cases, alternating between heat and cold therapy, which is known as contrast therapy, can be beneficial. This approach is often used to treat chronic pain or injuries where both inflammation and muscle stiffness are present. The alternating temperatures help stimulate blood flow, reduce swelling, and relax muscles. Precautions in cold therapy. While cold therapy is effective, it is important to use it correctly to avoid adverse effects such as frostbite or tissue damage. Key precautions include limiting application time to 15 to 20 minutes.